Good morning, ladies and gentlemen. How are you doing? I am Dr. Ataur Rahman Khan, consultant internal medicine. I hope you are doing well. But today I want to discuss about two important things, very important things rather. The things are like that what you're going to do if you have a crushing chest pain, like an elephant sitting on the chest, then you are thinking that you might have a heart attack. Chew baby aspirin of like 75 or 81 milligram, 6 to 8 tablet, then swallow with a glass of water. And call 911 in the USA, in other country, in their respective numbers, so that ambulance can arrive to your door and can take you to the hospital where PCI can be done, percutaneous coronary angioplasty. Most of the hospital in the United States has a catheter lab, and so is in Europe. But emergency technician, emergency EMS team will decide, EMS team will diagnose you en route to the hospital by electrocardiogram that you might have a heart attack, and they will send this electrocardiogram through Bluetooth to their respective physician in the emergency room or cardiologist, so that they can alert the cath lab, because door to balloon time is 90 minutes. Time is muscles. As soon as you take the action, you will be safe and sound, and you can protect yourself, and your heart will be protected, and you can prevent a death. Therefore, it is prudent and very, very important to think about calling 911 or other number as soon as you think you have an impending heart attack. Door to balloon time is 90 minutes, means that once you are on the door, then you will be transferred to the cath lab within 90 minutes, so that muscle can be saved. The other thing I want to talk about is stroke. Stroke has some acronym here to follow. FAST first. F is asymmetry of the face. You see the symmetrical face in both sides are same, but if a face one side is like this, or if you have the patient to smile, then you see some irregularity of the face morphology. A, arm swing. When you let the arm to raise both arms, let the patient, one of the arm will be drifting down or both of them drifting down involuntarily, then it is called FA, asymmetry of the arm. S is speech. Ask the patient, what is your name or how old are you? The patient will not be able to speak clearly. Then he or she will have a slurred speech, and then it is time to call ambulance. This is very important, because when you are taken to the emergency room or in the hospital where stroke unit is available, then your time frame is only limited, like 90 minutes. Within 90 minutes, the doctor will decide whether to give you thrombolytic treatment or not. It's very important that you go to the hospital right away. So FAST, once again, F is facial asymmetry, A is arm swinging, drifting one arm. Then when you let two arms to raise, one will be drifting down. And also minor symptom like numbness of your face, numbness of your arm or legs, lightheadedness, sometimes difficulty in breathing, sometimes maybe loss of consciousness. These are very important that you know the sign symptom of a stroke. Basically, most of the time, ischemic stroke and transient ischemic attack or TIA can be diagnosed right away with this. Hemorrhagic stroke also can be. However, it is important when you bring your family or yourself to the hospital, but do not drive yourself. Let some person drive you to the hospital if you don't have an access to the ambulance. Kindly note that in both cases, like impending heart attack and stroke, Time is muscle and time is brain. You can save your brain, you can protect your brain.